Hello, good morning, everyone. Welcome to the Workplace Safety Sessions. My name is James Scales, and I'm presenting today on behalf of Park City Consulting. A couple of housekeeping bits just to start off. Cameras and mics are not currently enabled, so please use the Teams feature for the questions and answers. Unfortunately, this is only a short webinar. As much as I'd love to expand on every subject in extreme detail, it does mean that I can only scratch the surface on certain points. And if you'd like some more information on anything basically in particular, please don't hesitate to reach out to us directly. There will be an opportunity for me to respond to your questions at the end, and if a point is very specific to your company, please make a note of it and, like I say, put it in the question and answers section. Yeah, from that point, I've got a lot to cover, so from my side, it's important that I jump straight in. He says. So today, my aim is to cover five different subjects and to give you a good understanding in relation to both Martin's and Benedict's law. What I'd also like to do is bring mental health back to the top of your safety agenda. We also are going to cover some accidents and incidents and the best tips in relation to those. And the last thing that I ideally want to cover is about engaging and challenging unsafe behaviours as a whole. So without further ado, I'd like to talk to you about Martin's Law. So Martin's Law is, well, it's called Martin's Law because it's named after a gentleman called Martin Hett, who was one of the 22 victims of the Manchester bombing. Really tragic circumstances. However, this has, through a lot of campaigning by his family, been passed into law as some very specific public protection legislation, he says. So, what does it actually mean? Well, the Act itself has already been passed. It was passed on the 3rd of April 2025, and the implementation plan is for 24 months. So it's well on its way. You may be familiar with parts of it. You may have heard it mentioned in certain bits of news and publications, etc. But the exact implementation date has not been publicised, but based on the 24 months, you can safely bet that it's going to be around April 2027. Now, what does this actually mean? Well, there are some elements that you need to understand whether or not you are even in necessary scope of Martin's Law. So, as I mentioned, Martin's Law is about public protection. So there are 4 elements that you do need to consider. So within the law, there is a couple of schedules, one of them being Schedule 1, and that's whether or not your premises is classed as one of these that are basically within the scope. And number 2, if the use is also relevant in relation to the Act. The next factor is how many people you would expect on site, and there are different things to bear in mind. So there are two tiers in relation to Martin's Law. One is a standard tier, and one is a enhanced tier. And finally, there are some exclusions. Some may or may not surprise you, but I will cover those in the upcoming slides. So, who is ultimately the initial question? Well, it's mainly covering the retail, hospitality, public-facing sectors, so things such as hospitals, healthcare, schools, retail, leisure attractions, places of worship, and anything from a public sector. Now, the reason these premises have been chosen because, unfortunately, if you do an objective look at various different terrorist attacks in the UK, these are your primary places of targets, unfortunately. It doesn't necessarily mean that you're automatically in scope if you are one of these venues or facilities. because there are some other criteria. So one of them being the amount of people on the premises at one time. There are some exemptions. Surprise, surprise, the Houses of Parliament have made themselves exempt in relation to this. But ultimately, it's for the exemptions typically cover open area elements such as parks, gardens, and open air sports facilities, which means that they are typically very difficult to contain, and so there'd be the natural element of dispersion. There are certain venues such as airports, rail stations, the Channel Tunnel, or port security that are also specifically covered by their own separate bits of legislation. And there are some special treatment for certain facilities, particularly those that are for places of worship and childcare and education premises as a whole. This law will be enforced by the SIA. So the SIA is the Security Industry Association, and they will have very similar powers to the HSE and the EA in relation to enforcement. In relation to capacities, it is important to note that if you are below 200 persons, you would be outside of the scope. So there would be no obligation to change what you're doing. However, it doesn't mean that actually that the advice that is within the Act and the guidance would is best to be ignored, because there are some good tips certainly within that. Within the standard tier, this would be if you have 200 persons or more, so 200 to 799 persons, and this is active people on site or basically within the venue. So it does include everybody from staff, so it's not just public facing people, it is also the staff side of things as well. But it doesn't include, say, for instance, if you were hosting an event over the course of a day and you're expecting 1,000 people to attend, but there was only 500 people, as an example, at one point, you would still be within the standard tier because the most people that you'd have on site would be 500. The main driving things for yourselves to acknowledge is, as you can see, over 800 persons, there are different things for a qualifying event. So that may be a specific event where your facility might be, like say, hosting a specific show. You might find yourself part of a qualifying event if you attend certain conferences, as an example, as well as if your facility has 800 people or more at one point, you will enter the enhanced tier status. So that does mean that you'll need to do some specific things, and I'll cover those very shortly. What you need to do, firstly, is try and understand who is the person who's got the ultimate responsibility. And some of the issues occur when there are shared operations, so where you've got more than one business or contractor on site, and who is the person who's going to be in charge. Now, typically, it is the person who is controlling the operation. That may not necessarily be the landlord. It could be, it's most likely going to be a event organizer or the largest firm, certainly on the premises. And this applies, just to reiterate this, where people have public access. So if your business naturally has, say, 1,000 employees as an example, but you're not open to the public, so you don't have a showroom, you don't have any form of public access, this will not apply to yourselves. However, if you do find yourselves in basically within this criteria, then obviously there are things that need to be done. And one of the main things, certainly from an enhanced here, is as always, when there is some serious comeback in relation to the legal side, they ultimately want a name who they can trace it all the way back to. So that's typically going to be a senior figure from an organisation, maybe the managing director, maybe the marketing director, or whoever's necessarily in charge of the event. within Martin's Law, it specifically states that you need to look at 4 specific things. So one of them is how to evacuate. One of them is how to evacuate. So exactly what they say on the tin. One is about getting out of a building. One is about moving into a designated part of a building. So they are very, very similar, but one's in, one's out. The next part that you also need to consider is lockdown procedures. And the most important part of it all is actually part 4, which is how you're going to communicate this basically across. Communication is very, very key because it does also affect the way that you need to train this out. There's also the element that if you were in the event of a lockdown, you don't necessarily want to be going around screaming, "Oh, there's an attacker in a particular area," because it might incite panic. Certainly, if you're, say, within a school or with a large element of public gathering, one thing that you can guarantee with human beings is they are quite random. And so people will react in different ways. You will have people that will trigger a fight mechanism, and you'll have people that will trigger a flight mechanism. Now, one of the good things from a communication part is you are the ones who get to control that. So you might choose to use some coded language, for an example. Within the enhanced duty, there is a lot more onus on having things recorded. So if you fall within the standard tier, you have to have the processes and procedures, like say, in relation to the evacuation, lockdown, and the communication. Now, as with everything within health and safety, like say if you've got less than 4 employees, you don't technically have to record your risk assessments. However, should you find yourself on the wrong end of things, you don't want to be stood in front of a judge going, "Honest Gov, we did do that." So as with best, it is best to record in both parts, but the actual legal requirement falls within enhanced premises and qualifying events. Now, these events do need to have those procedures and processes documented. They specifically, they will need to be submitted to the SIA in advance, as will when you fall within scope of either a standard and enhanced premises or qualifying event. You will need to register with the SIA to notify to notify them that you do fall within the scope of Martin's Law. Within the enhanced duty, you're kind of expected to step your security up a notch. A number of you will have experienced these kind of measures in place at certain public events that you may have attended. Things such as concerts, where you get bag checks, as an example. You will have patrolling security. You'll see the use of CCTV, barriers, crowd control, and more physical, basically security measures in advance. These are all things that will not necessarily be expected that you need all of them, but certainly a proportionate and appropriate response. Something that a number of you will be familiar with, the term reasonably practicable. So used all the time in health and safety, but in layman's terms, what a reasonable person would do. It is important, I think, now to start thinking about whether or not you fall into the scope, because ultimately you do need to start preparing now, because we are going to be at the point where the clock is going to tick, and then all of a sudden there's going to be a lot of events and businesses that are potentially non-compliant from April 2027. We ourselves at Park City can obviously assist you in this, and my advice to yourselves is certainly if you're in the standard and enhanced tier is to reach out directly to us, because I can't cover everything specifically from a webinar perspective in regards to all the various different niches, but I will say that you won't be able to necessarily have a copy and paste job, because each plan of action needs to be relevant to the premises, and unless you've got a carbon copy building, it's unlikely that you're going to be able to, like say, just pick a solution up directly off the shelf as a whole. Moving on to Benedict's Law, as you'll see, I'm a king of segues, so if at some of them they feel like a bit breakneck, I apologise in advance, but like I say, there's 5 subjects to cover today. And Benedict's law specifically is a law that is aiming to tackle safety and allergen control within schools. So this is unfortunately as per Martin's law, this was named after a gentleman called a young lad called Benedict Blythe, who was only 5 and tragically lost his life because preparations weren't in place. And the idea of Benedict's law is actually, if we follow the recommendations and guidelines that are within the guidance, we should be able to prevent this from occurring again. So, I got it in the wrong order. Yeah, sorry. Apologies. I'll skip over onto this one. I'll come back on this one. Yeah, so it is a school allergy safety law, which is specific in relation to England. Is currently affecting public schools, so anything state funded. The private school sector is not currently included. However, that is coming, and it would be my advice for people to follow exactly what's being put in for the public school sector. I do need to add in that this is not a replacement for Natasha's law. So Natasha's law is the requirement for food allergens to be made clearly displayed in relation to prepackaged food and at restaurants. And it is still also relevant to work alongside Benedict's law as a whole. This law is specifically aimed at a whole school approach and not just a catering or a first aid only issue. So whilst this may not be directly affecting yourselves as the fact you may not be a school, as an example, if you do have people who come on board in relation to work experience, or you might be a public sector facing where you might get school trips or similar items, you will be asked to assist alongside this, because this is not just it's not just limited to the school premises as a whole. So like I say, it's currently applying to all of the public sector schools. Academics and free schools are also kind of in the same boat. The PRU, so the pupil referral units, all of these are currently in scope. So it's only the independent and private schools, which they're expecting for this to kick in live in January 2027. The early years and the further education will also follow it, probably in a similar kind of timeline in relation to that. So where do you start with this? Everything, as with everything, it all starts with policy. So it's a declaration about what you're intending to do. So in relation to this, the main things that I would highlight from a policy is a policy sets out what you're going to do, who is responsible, and then what resources that you're going to apply to this. So this isn't just necessarily to Benedict's law, this is all of your policies. A good health and safety policy will meet those criteria. And so it is important that you do look at where you're going to identify the source of these various different points. And there are also similar things that you want to take a note from new starters if you don't have this in your induction as a whole, because people with severe allergies are not vegans, is the way I describe it. So a vegan will typically tell you that they're a vegan within 5 minutes of meeting you. Meanwhile, someone who's got an allergy is normally somebody who doesn't want to cause too much of a headache, and will, in some cases, keep it relatively close to their chest. However, during induction processes, and certainly as you're onboarding new students, this may be something that comes to light afterwards, where people were not necessarily aware that they were allergic to certain things. It is important that we identify it as soon as possible, because, like I say, severe allergies can cause anaphylactic shock, which, if left untreated, will be fatal. Specifically in relation to the children, and in all schools, you'll be expected to add this to their individual healthcare plan, where specific support is needed, especially if they have their own medications and their own adrenaline auto-injector, AAI, or EpiPen. And it is important that we share it with the relevant people. So it's not about just gathering the information and not sharing the information. So, for instance, if you've got somebody who's allergic to certain things, there is a relevancy of informing your first aiders and people who may be interacting with either the child or the individual who may carry these allergens. It isn't for everything to be put on public notice. This is still GDPR sensitive data, so it is important that that the information is shared with relevant parties. But in terms of a school, it is expected that includes everybody, because the requirement to train there is a requirement to train everybody on an annual basis within a school and education setting. So some of the things that you need to make sure are happening is the accessibility of the adrenaline. So one example that I'll use is, for instance, if somebody has an allergy and they come with their own EpiPens, you are expected to be able to provide the correct storage for that, which is typically normally in a fridge, which I would advise to be a dedicated element so it's not contaminated with food. These are quite standard practices within most schools. But the rule of thumb for adrenaline is within the guidance is that it should be accessible within 5 minutes. So you should be able to have it administered to the individual within 5 minutes. It is also important to acknowledge that you don't, if you are having anyone who's suffering from anaphylaxis, is you are not expected to move the individual, the casualty, to the adrenaline. The adrenaline is expected to move to you, which does mean that, like I say, everybody needs to be aware of the emergency process, and certainly carrying out some drills, certainly in relation to other emergency activities, such as fire, as a fire drill, as an example, is good practice. Okay. I did mention it previously, but it is important that everybody in relation to the education setting is trained. They do need to be able to identify triggers. They do need to have some practical understanding of CPR, as well as obviously the ability to use a EpiPen or a AAI. And it is something that we at Park City can support. It is also important to note, I did mention this earlier on about how this has relevancy to other people outside of schools. The duty travels with the pupil. So trips, clubs, anything like that, if a child has a EpiPen, it must travel with them. So you must make provisions in being able to transport that medication, and also ensure that everybody who is also on that trip is aware of that point. So it is about the requirement for assisting somebody who has a severe allergic reaction would qualify as a disability under the Equalities Act. So reasonable adjustments are expected to be made. So you can't discriminate against somebody. And the guidance specifically states that it is not about excluding anybody. It is about trying to create an inclusive area and creating a single environment that has for instance, trying to create a nut-free environment is not an effective method, because typically it means that people become a little bit narrow-sighted and they may miss other allergens. It is important that everybody is trained, and the reason they want everybody is trained is because ultimately some people may not be in the know. And people may bring their own packed lunches, etc., which is why it's important that information is shared with parents and guardians in advance. The best learning experience typically comes from near misses, which means that you've had a close call, but fortunately people have got away from it. And it is the same with anything in relating to safety. Whenever you do have a near miss, they are as valuable as an accident, because you've had all the learning opportunities from the same kind of thing, but without the damage. So as with everything, make sure that you are recording everything, you are reporting it. And when you are going to do investigation, remember that you're not going on a witch hunt. We're just trying to understand exactly what's occurred to try and prevent it from happening. And as with everything, make sure that you are recording your findings, because ultimately, if you haven't written it down, you might as well not have done it in the first place. Outside of schools, like I say, I mentioned how you might have the element of work experience or school trips, etc., but you've still got the control of allergens that are still required under Natasha's law, and as I mentioned, a severe allergy would qualify as a disability, so you are expected to make reasonable adjustments. It is important, like I say, that you do treat it as an entire school approach, and ideally, it's not about trying to isolate. It's about trying to be inclusive and ultimately trying to educate people in an education setting, he says. Right, after two relatively heavy subjects, let's get on to the next one as a whole. So, mental health at work. You've probably heard quite a lot of people over the last, I would say, mainly since COVID, realistically, where mental health started to get highlighted more as we found ourselves in quite a lot of isolation. Now, mental health as a whole, it is important that we look at its actual impact on work as a whole. Now, it may surprise you to know that the leading cause of absence from the workplace is depression, and anxiety. God, it's giving me anxiety trying to pronounce today, he says. But it is important to note that from a numbers perspective, that there are, the amount of days lost within the UK is well over 22 million in relation to stress, depression, and anxiety. Now, to compare that with something like manual handling based injuries, it is triple the number. So approximately 7.1 million people had lost days, basically in relation to manual handling, as opposed to the 22.1 million. The other thing to note about mental health is it is ultimately underreported. So this is what was taken from the workplace from the workplace labour survey, which doesn't cover everybody. There's also still a bit of stigma that is attached to issues with mental health. So people may just tell you that they're generally sick, and actually they're not. In terms of physical side of things, some of them are symptoms that also get attributed to the physical output of it. So, for instance, people who suffer from anxiety can often find themselves being physically sick, and they'd attribute the physical sickness rather than the actual anxiety element of things. And the reason I'm harping on about this, and what I really want you to consider about taking away, is not only is this the leading cause of absence, it's also related to the turnover of staff. So, where staff are not happy or they're struggling, they will typically look for a clean break and a complete alternative solution. So a good mental health strategy is very important in relation to the retention of your staff. When you also take into account the total amount of people in the workforce in the UK, in the last survey was just under 34.5 million people, an employment rate of about 75%. When you take those numbers, that is approximately 1 in 35 people that is having a extended period away in relation to mental health. Now, when the average case is looked at 22.9 days, and you look at a standard working month, that is the equivalent of 1 in 35 staff having a month off per year, which is absolutely staggering kind of numbers, and that's quite a loss to the business in terms of from a productivity point of view. So, also the HSC, this is right in their forefront. This is right in their scope. This is something that they're really leaning on, and so from a mental health side of things. What I'd like you to do is to go away and ask some questions of your organisation. Have you got the right policies in place? So do you have a mental health policy in the first place? If so, have you got objectives that are tied in relation to it? And have you committed the relevant resources? If you go speak to any doctor or medical professional who's worth their salt, they will always tell you that prevention is better than cure. And we say that also in safety, because it's a lot easier to stop things from happening than to deal with the mess. And this applies to mental health as a whole. So it is about understanding and being observant. And one of the things that people are quite poor at as a whole. And you may find some of your colleagues, you may even find this yourself, is you were good at a particular job, you've put all of the effort in, and you've found yourself either being nominated because you're either the only person who didn't step back, or you've been promoted into a management or supervision or supervision position, and not necessarily been given the relevant training in relation to that. It is important to equip the people who you want leading your mental health strategy with the relevant skills. So whether that's managers, supervisors, or mental health champions, it is about helping people understand and spot these differences. Now, I don't know if I'm going to make you slightly depressed as I highlight this fact to you. You spend more time with your work colleagues typically in terms of say if you do a 37, 40 hour, even 50-hour week, than you do with sometimes your loved ones on that side. Because if you think about by the time that you've driven home, you've had a little debrief, you spent time with the family, and then you're sleeping, and then all of a sudden you're back up, and then you're back in the car, and then you're on your way back to work again. So you spend a lot of time with your work colleagues and you notice their patterns, and it's quite easy to see typically when someone's having a bit of a bad day or they're a bit off. And it is about understanding how you can take those observations and then you can apply a good mental health strategy in relation to that. So it's about making sure that the organization supports in many different ways. And with everything, it's always about learning things. It's a continual journey. Not many people get things right in the very first time, so do not beat yourself up over this. But ultimately, it's like, well, actually, what can we do better? What signs can we learn from behind in moving forward? There are many different options that you can provide people in relation to support, and it could just be as simple as just asking if somebody's all right. And when they give you the default response, just asking them again, as well as providing things like self-service. So it's quite common now to see things such as EAP, so employee assistance programs, which will have things like well-being hubs, perhaps some remote counselling, some just general tips and advice in relation to general work-life balance. You can provide internal people. So this might be mental health first aiders. And as somebody who's been through that course, I can tell you that it is a very eye-opening course. And I'm sure there's going to be a number of people of you who have been on it as well. And will also agree that the quality of the course was fantastic. And the other thing that I would kind of want to push you in relation to, considering is a lot of firms that have gone through the mental health first aid side of things, they've had a great initial push. Is that still being supported? Have you had some colleagues that have moved on from the business or moved departments and now actually you're a bit short on numbers? Are people aware? Have you had new starters where you've shared this information with? As with everything, if something is becoming even more serious, to the point where it's having a direct effect on somebody's health, there is professional help from occupational health surveillance providers, obviously people's GPs and NHS. The mental health side is not about creating a bunch of internal experts. It is about signposting. It's about identifying these signs and steering people towards the relevant support services. The more support services that you provide somebody, the more likely they are to access them as a whole. And obviously there are enhanced elements in certain businesses. Certainly the education settings. You will also find there are safeguarding concerns and other parts that also do need to be flagged as well. One of the things that is always interesting is the amount of responsibility that falls on a manager's shoulders. Now, if you've ever come across the element, I'm judging by the most of you and the fact that you're coming out seeking some of the information and knowledge in relation to this point, you'll find yourself in this boat where where nobody volunteers to do anything, and it's suspected that you'll be the one who will be the one to support these things. And like I say, without the right training and information, it's hard to necessarily know exactly what the right thing to do is. And in relation to mental health, people's different scenarios are different because it might be something that's from a personal factor, so driving factors from people's own personal lives. They might be going through a difficult time in a relationship. They might have experienced some grief or some personal tragedy. They might just be generally struggling in certain aspects. And regardless or not, they might bring that into the workplace, and it's important that you try and engage and tackle this in advance to offer that individual the relevant support. So it is about giving yourselves the tools and equipment in order to be able to handle this situation, because these are not the easiest things to do. There is an emotional burden that comes with undertaking this information, and with the right training, such as mental health first aid, such as just general managing skills, whether it be engaging in difficult conversations or something like the Child Management Institute CMI management training, as an example. These skills and tools give you the element in order to engage and communicate with people, understand the best processes and tactics that you should undertake, where you should be signposting people towards, and ultimately try and stop things from escalating into something that leads into, as I mentioned earlier on, one of these cases that that will span basically across multiple months. Because typically when you come across depression, anxiety and stress, they're not 5-minute solutions, but if you can catch it before it actually escalates into that, then you won't lose any you won't lose the individual for any period of time. I did mention about having a variety of different things for people to support, but do your staff know that there's, for instance, an EAP program in place? Do people know where they can access the resources? Because it's very common that people get it on their induction or when a project is launched, but typically it's not always very well in terms of the ongoing upkeep of this. So actually, what has been shared with everybody? Is it something that people are given the information to on a regular basis? Also, how easy are you making this? The easier you make it, the more likely somebody's going to approach to use the services. It is about also keeping the strict confidentiality side of things, because as with everything, and this is just general management as well as safety, everything is based on trust. There is a trust that people will do the job that you've asked them in the specific way that you've told them, and as soon as that trust is broken, it does mean that the relationship starts to break down, which then, from a mental health side, has a negative effect and also makes it less likely for those individuals to engage with any of the support services that are being provided. It is also important that there is a consistency in delivery. So it is all very well and good, individuals like yourselves who are most likely quite passionate individuals about looking after people and improving things, that actually this is a message that goes across the board and is led by example. There are some free resources that you'll see on the QR codes that are available by the Park City website, available to be downloaded. I do advise that you do tap into them. They're free, good and great resources to help push you along on that one. Just finishing off on the mental health just quickly there, it is important to acknowledge that it is a very hot topic for the HSE. They are expecting to see it in your risk assessments. They are expecting to see you have taken actions and control measures. So my first port of call for yourselves would be to go check your risk assessments, make sure it's in there in the first place, and make sure that your control measures are up to date. So quickly moving on to accident and incident reporting. Bear with me 1 second. When you talk too much like me, do need a swig of water once in a while. In relation to accident and incident reporting, it's never the thing that you really want to be involved in. Unfortunately, I've been involved in quite a number of serious incidents and accident investigations, some of them all the way through to fatalities, and some serious life-changing injuries. And I'm not going to necessarily sit here and trauma dump on you all, but I can tell you from a personal side of things, it's not a very nice thing to find yourself in. So just for a few bits of clarification, I'm just going to go over a couple of bits of terminology and language. And the one I'm going to start with is accident. And so when you have an accident, it's typically an unplanned event that has resulted in injury or ill health or damage to an individual. Okay. A incident is one step up, which is a broader adverse event, is the way to describe it. So an accident can be an incident, but you can also have incidents that are not accidents, and by that I mean where some individual doesn't get hurt. You might have some property or some plant or or some other equipment that might be damaged, as an example. You'll hear the term near miss floated about. Now, near miss typically um, is something that it kind of makes me laugh, because if you nearly miss something, technically you hit it. But the term near miss is typically used to cover people describing a scenario where the accident didn't quite happen and you got away with it, but it had the realistic potential to cause harm. I also know them as the squeaky bum moments, because they do make you clench your behind. But fortunately, everybody gets to walk away from those. A hazard / the concern side of things is typically a unsafe condition or practice that is identified in advance. And as with everything in relating to accidents and incidents, RIDDOR comes up on a regular point. So RIDDOR is the reporting of injuries, diseases, and dangerous occurrence regulations. They lay out some specific criteria on when things need to be reported to the HSE, the enforcing agency for health and safety in the workplace. In relation to accidents and incidents, I can't stress this enough. The first 60 minutes post a incident or accident is the most critical of all. So it is about, and I'm going to make a number of assumptions as I say this, is the individual's care is number one priority. It's about getting the relevant first aid, emergency services, and aids to the individual who has potentially been hurt in relation to that. From a business perspective, it doesn't just stop there, though. So it is important that if you do have a serious accident or incident, that the scene is preserved. And the reason being is you want to be able to get as much information as possible. So it is about obviously ensuring the first aid has been administered, is isolating the area, and then it's then the point of then capturing the information. So that is, don't immediately just start up and tools and working again. It is about trying to understand or as much of the evidence in its purest form as possible. And the reason I say the words purest is typically when things start to get moved, it taints things. It will then affect the incident investigation. Also, things such as witness statements. It's easy to see if you see the children's game telephone, where they start with one message and it passes along from each person. A message will slowly get warped over the course of time, and that happens with witness statements, where people start to fuse their accounts together, and then necessarily you've got people repeating the same things, and that might not exactly be what they saw. So it's important that having the right process in relation to incident and accident reporting is undertaken. So my thing that I just want to highlight on that is that does include necessarily separating people and taking individual witness statements completely separate. And as business leaders, if anything goes wrong on site, you ultimately want to know. So it's about making sure that you're notifying the right people. So some of the ones are obvious: managing directors, competent safety people, but also people like your insurer. Your insurer will want to know, because they will also have their processes and procedures to follow. And from your own benefit, certainly if there's going to be a large claim or in relation to compensation or actual damage in relation to plant or property, the insurers will want to know as soon as possible, because they'll have their own processes to follow, and there's quite likely terms within your insurance policy that will require you to notify them. And they're not saying that it would negate your insurance policy, but we all know what insurers are like. Any opportunity not to pay out, and they won't, he says. There are also some specific things that I do want you to also acknowledge, which is in relation to RIDDOR. There are a number of things that are reportable, so they are specific injuries, as an example. So there is a list in the RIDDOR, basically in the RIDDOR regulations, that are very specific. Typically, things such as burns over 10%, fractures outside of fingers and toes, scalping. There's a full list of them, and there's also a full list of dangerous occurrence events. And if you meet any of these criteria, you are required to report it to the HSE. However, I will stress that there are certain scenarios where that isn't applicable, and it is where things are not necessarily work related. So, for instance, if you have an individual who, through poor health, they unfortunately experience a heart attack and pass away, if there is nothing tying it to the work side of things, that is not RIDDOR reportable. My advice to yourselves, if you're ever stuck in that point, is to reach out and to ask for it to be clarified on that side, because it is very specific. And I'm not saying that we don't want the HSE turning up on site, but the HSE, when they do turn up on site, do like to try and find something wrong so they can charge you some money because they are self-funded. Ultimately, understanding exactly if you do meet any of this RIDDOR side of things, the time frame. But typically, if you've got a death, you've got to notify them immediately. But if you have a specified injury or a dangerous occurrence, it's 10 days. There's the second half of RIDDOR, where if somebody is off work over 7 days, then that also does need to be reported. So regardless of the injury, if somebody's had a work-related incident and they're not at work within 7 days, and when I talk about 7 days, say if they were to have the injury today is Tuesday, you would not count today. So day one would be Wednesday, and you'd count the days all the way through to when you hit day 8, which would be the following Wednesday, and that would be the date of where you'd have to notify it to the HSE. I will also highlight the fact that if you have an over 7-day injury and you bring somebody in to do other duties, so light duties, that doesn't mean that they're out of the 7-day window. The 7-day window is that the individual returns to basically returns to their work and is capable of doing their normal day-to-day duties. I'll also like to say, and it is a bit awkward, if you've got somebody who has an injury and then goes on holiday, you still have the duty to check that they were available to work on their normal duties within the 7 days. So it's something that is very awkward, but you might need to reach out and confirm with an individual, which might be a little bit difficult, especially if they've gone abroad as a whole. Ultimately, RIDDOR is required from the point of knowledge. So as soon as you know, as soon as you know it, to meet one of the criteria, that's when you've got to report it. If you're unclear of the severity, then it is important that you do that you do report it as soon as it has become clear. Do not report anything if you are unsure in relation to if it meets the criteria. The HSE don't like over-reporting in relation to that. Just going back to the accident and incident parts, is making all of the P's to make count. So the things when you are gathering evidence, think of the place, the environment that has occurred, the plant, the process, and the people, and treat them all as individual elements. If you've got some CCTV, that's going to be great, because you'll be able to see it in live time. But typically, quite often with CCTV, an incident always occurs just outside of the line of sight. It's always sod's law, as I always say. But it's also making sure that you do review all of the P's on that thing. So don't just rush into assuming what a particular root cause is, because there'll be a number of causes that will have led to the accident or incident as a whole. So when you are dealing with any accidents or incidents, it is important that you do make a plan, and from that plan you'll have a number of actions. So one of them will be to carry out the investigation as a whole. But when you are giving actions from the investigation, it is about assigning them an owner, assigning them a specific timeline and a measurable objective. Make them have SMART objectives. It is very important. And it's also important that somebody takes ownership of the accident and incident, to keep on top of people, to ensure that everybody is carrying out everything that's needed. So it is important that you do things right. That you do things right from the start. If you are a retained client at Park City, one of the things I will say to you: pick up the phone. The sooner you speak to us, the sooner we can assist and basically help get involved in that thing. Ultimately, I hope to never receive that phone call off any of you because we're all lovely, safe workplaces. Moving on, just a quickly thing, which is ironically something that may link directly into the causes of the accidents and incident side of things, and that is unsafe behaviours. And it is about understanding exactly where this has come from. Now, I'm sure you've had a number of, it might necessarily not be even necessarily be a safety element. It might be an operational process, but it's understanding exactly why something has gone wrong, and it's looking at the human factor side of behaviours and their decisions of it. So the behaviour itself is not the be all and end all, but it's important to understand that which kind of category that you're kind of falling in. So the HSE itself, they do classify them, and when you've got something that is an error, we're all human beings. We will typically make errors, and so that will be where you've done an action where it's not, for instance, what you've intended. So that would be a slip. You might have forgotten something, so it might be something out of sequence, or you've missed out a step, or you've made a mistake in relation to the planning, but you've followed your logic brain. But however, it's kind of gone wrong, and the output is not what you wanted. Now, errors will occur. Ultimately, we want to make them as small as possible. So having robust systems and processes and procedures make these less likely to occur. But errors typically are not found in a negative kind of connotation. The other side of things are violations. Now, violations are where people have specifically chosen to make an action that is against the rules or procedure, or it may come from a place of malice. It might come from time pressures, etc. Ironically, as I say that, as I'm looking at the clock myself. But ultimately, from a behavioural perspective, violations are things that need to be tackled and identified at the earliest possible convenience. One of the easiest ways to understand exactly what's going on in relation to unsafe behaviours is using our pause technique. So as with anything, if you spot anything that you're not happy with in relation to behaviours or actions, the first thing that you need to do is try and make the action safe. So if you've got somebody up a ladder, screaming at them from the bottom of the ladder isn't going to be the most appropriate response. What you want them to do is to disengage from what they're doing in the most safest manner possible. So that may be speaking to them on a relatively calm way. And one thing to bear in mind is just think to the last time that somebody shouted at you directly, and how well you personally reacted to that, and you may have taken on board any form of criticisms. And typically, the answer is that's not a positive response. It is also one of the best ways of dealing with unsafe behaviours and things that haven't gone the way that you expected them to do is to ask neutral questions. So things such as asking them to talk you through what's happening, to ask them to explain where the situation is, not emphasising blame directly on that, because what we're trying to do is we're trying to educate and steer people into safe behaviours and change their mindset and the culture of an organisation. So one of the things that I find quite effective is if they do come and acknowledge something that's being unsafe, is to ask them the question: Do you think I want you to work unsafe? And the answer by everyone will almost always guarantee be, of course not. On that side of things. And so it's about reinforcing the positive message. So at that point, just remind them that their safety is important to you. And it is important whenever you have any of these interactions to follow up, to make sure that it's not just that individual and it's the message is shared across the board with the teams, and also to set and escalate. As leaders of the business, you will find that you need to be on that pedestal. You need to have what I call a visual felt leadership model, which means that you need to lead by example. And so if somebody does correct you, if you, for instance, go out into the factory and you're not wearing a high vis and they say, oh, you haven't got the right shoes, shoes on, you haven't got the right PPE on, acknowledge the fact that somebody has pulled you up and support that. It's very, it is very important in relation to embedding it in the culture. Um, on the slides, you can see there's a number of questions to try and understand exactly where the unsafe behaviour has come from, and it isn't just directly what comes out of the individual's mouth. It can be individuals, it can be witnesses. There can be a number of external factors such as management systems that will all add to these things. If you were to ask all the questions in green in relation to the incident, you'll get a pretty good understanding about where the source of the behaviours come from. And ultimately, it is about matching the response to the cause. Now, obviously, if you've got somebody that's made a mistake, or a slip or a lapse, it's not come from a place of negative intentions. It's about educating and preventing from moving forward. If you've got somebody who's knowingly breaking the rules, that is where we come into the other side of the Park City's business, which is more about the HR side. And so it's ensuring that everything is recorded properly, because it may be used as evidence further down the line in perhaps a disciplinary hearing or whatever route that you'll choose to go. But ultimately, regardless of which side of it it's come from, what we're trying to do is prevent these bad behaviours. And it is from a manager's perspective, side of things, a manager's, supervisors, or even your peers and your colleagues. Why would you stop a task? Well, I can tell you why you'd stop a task, because every time I've gone to a serious incident, I hear the same phrase all of the time, which is, I wish we would have just. And it's the most frustrating thing ever, because there's always somebody who said, I wish we would have stopped them at this point. I wish we would have intervened. And it's a lot easier, like I say, going back to callbacks from earlier, prevention is better than cure. And like I say, you spend a lot of time with your work colleagues, and there'd be a very large hole if they weren't there the following day. So it is about having an open and honest conversation, and not getting angry, not being aggressive with it, but letting people know how you feel about that task. If you see somebody working unsafe, let them know that it doesn't make you feel comfortable watching them take risks. And so these are all skills that can all be packed into one. And so when you look at the importance of building and giving the tools to the managers and supervisors, this is why things such as management training is very, very important in relation to that. We do have, as part of the webinar, also some another free resource in relation to accident reporting and flowcharts. There are all the mental health ones that I've mentioned previously. There's also links to the various different training training opportunities that we provide as a whole. But we have covered in quite a tight hour. We have covered quite a lot in relation to Martin's, Benedict's law. Talked a lot about mental health and the right behaviours that you need to do in relation to incidents, and also, helping prevent those by challenging difficult behaviours. The thing for yourself that my question and my takeaway to yourself is, which of those subjects needs your attention first? What is the thing that you're going to make your priority? And what steps are you going to do about it? So is that an element where you're going to move forward, take it away and go, right, actually, I'll give Park City a call later? Or actually, yeah, I want to do some more research into this particular subject. I need to go speak to a colleague to see if they've got this in hand and double check what's going on. To take something as to add to your to-do list today. Which one of those are you going to go chase up today? Okay. Thank you very much for sitting through the slides. The one thing that I do want to highlight now is if there's any question. Oh, apparently there's no question or answers. So if anyone would like to get one in a quick manner, then by all means. But if you wish to raise your question separately offline, by all means, please do so. I just want to give out a couple of thank yous in relation. So thank you to yourself for attending and sitting through the webinar. If you're watching it on recording, hello, on that side. But also just in the background, Katya has been very great to me in terms of getting it all set up from a technical side of things. So round of applause for her. She's done absolutely fantastic. And like I say, just as a parting note, then, if there's no further questions, is what is going to be your next course of action? Thank you for your time. And look forward to speaking to some of you shortly.